Good evening, everyone. I'm Paul Kigpine with the Garland County Library in Hot Springs, and we're here once again with our Garland County Health Officer, Shelby, to discuss the current state of the COVID-19 pandemic in our area and answer any questions that you have for him. I know we're going to cover a lot of topics ranging from vaccines to treatments to symptoms, so please, as always, don't hesitate to comment or ask anything you want to know. So today is Thursday, January 7th. And Dr. Shelby is going to kick us off with his latest progress report on the state of the pandemic here in our area. Before you do start, Dr. Shelby, it's been widely reported it will be months before the vaccine is widely available to the general public. So I was hoping you would address the rollout and availability of the vaccine as part of your introduction. So for now, I'm going to turn it over to you.
Okay, thank you, Paul. Appreciate you having me back and having this series. As Paul said, I'm the Garland County Health Officer and a member of the Garland County Task Force that to deal with the pandemic. We started meeting in early March, and we meet every Monday morning by Zoom with members of the our local political leaders, the first responders, the police and fire department, but also we've added to our group the school superintendents and the Office of Emergency Management, even and people from the business community. So we have a pretty wide group, and we really try to discuss where we're at and things that we can do as a community to deal with this terrible pandemic that we're living through. So I'd kind of like to start with like I said, we meet on Monday mornings, and generally with our meetings, I give a report based upon the activities of the virus in the previous week. And as expected, with the holidays, we are seeing a significant increase in the virus in our community. And then some of the numbers that reflect that of the report that I gave on Monday morning was that during the week that ended on January 3rd, which was Sunday night, we had 554 new positive cases in Garland County, and that's and our testing was about 3,200, which is about average for us. Have to kind of remember that that includes the New Year's Day holiday, so that it kind of impacted the testing some. But the 554 new cases in just 1 week was definitely a record for us, and it was up significantly from weeks previous. Our testing, like I say, was about 3,200, which is about we're kind of running an average of 3,000 to 3,300 tests done per week, so that's pretty much on our average. But the 554 cases that averages out to the 79 new positive cases per day in Garland County. And we also had a kind of record high on our active cases. We had 704 active cases, which was an increase of 101 from the previous week's report. And then our deaths we're up to 155, which was an increase of 14 in just 7 days. So that was during that week we were averaging 2 deaths per day during that time frame. So looking back historically of how the virus has impacted Garland County, we can see that we're definitely on a very strong upward trajectory that is bothersome, but it's also not unexpected, because since we started really tracking this back in March and April of 2020, we've seen the increase in our activity of the virus, usually following the holidays, the 3-day weekends, starting with Memorial Day and then going on through the Thanksgiving holiday. And so we were expecting this. We were hoping that the things that we're doing to try to mitigate the spread of the virus was such that we still really urge and encourage the wearing of masks, the social distancing, hand washing, and just and avoid groups of more than 10 people, and avoid even smaller groups of people that you really don't know. And I continue to really encourage that, because that's really at this point the only thing that we really have to try to slow down the curve of upward spiral of disease. And one of the things that I generally look at is the distribution of the cases around the county, and it really is very widespread. We are starting to see an uptick in the Hot Springs Village portion of Garland County, where we had 41 cases the previous week. We're up to 75, so that's a significant increase in that population. We've also seen some spikes in the Royal area and in Jessieville. As far as any really specific hotspots, we really haven't identified any for certain, but it's definitely just a lot of virus going on. In preparation for our discussion tonight, I did kind of update my numbers based upon today, and unfortunately, we're seeing even a stronger increase in the trajectory of the cases, because in just the last 4 days, from Sunday night to tonight, we have seen an increase of 536 new positive cases, which for 4 days, that averages out to 134 new cases per day. And in our testing has been pretty flat. And we had in those 4 days, we've only had 1,908 tests done. So that shows that we have like a 28% positivity rate, which is very, very alarming. Anything over 10% was concerning. So to be up in that range is very bothersome. And then also we've seen a dramatic increase in the number of active cases. We had 704 on Sunday, and we're up to 890 today, which is an increase of 186. One of the things I talked to a group earlier this week that I really felt like we were on the trajectory to have over 1,000 active cases in Garland County, and unfortunately, I think we're going to see that sooner as opposed to later. One thing I want to kind of talk a little bit about in terms of these numbers, because I think sometimes there's a little bit of confusion. When we talk about the new cases, those are people that have just now have had a test that is positive. Active cases is a more dynamic number. Active cases is certainly people that do test positive, go into that grouping, but it's a big variation as to when they come out of that grouping and become basically recovered from the infection. For the asymptomatic group, generally they're considered active for 10 days after the time the test was done. If they have no symptoms. Now, people that are symptomatic, they can stay on the active list for weeks or months if they continue to have symptoms, and that's a different ballgame. And as far as our active list, I mean, there are people that have been on it, for 4 or 5 months, and again, that's part of the disease, and unfortunately. That's what we have to deal with. So that's kind of where we stand. Normally we've seen the spikes after the holidays. We start seeing some for the week after Christmas, and but a lot of times they don't really show up significantly until about 10 to 12 days after the holidays. So I think what we're seeing this week is we're seeing the end of the Christmas spike and the beginning of the New Year's spike, and that really doesn't look good for this week in terms of where we're at. So that, as far as and as far where we are in our numbers, one of the things that was discussed at our our meeting on Monday, we have representatives from the hospitals, and the two acute care hospitals we have in Garland County are definitely seeing the impact of this. They're seeing on patients that come, that they do testing at the hospital, they're seeing a very high positivity rate, and the number of patients that have to be hospitalized is going up, and the numbers in the ICUs and ventilators. They haven't necessarily reached capacity yet, but they definitely have their surge plans in place, and hopefully they won't need to implement those things, but they'll be ready to do so if we have to. And again, with the trajectory of new and active cases, that's going to put more strain on our already strained healthcare situation. And unfortunately, the more people that we have with a severe illness, we're going to have more deaths. And one of the things that I had mentioned before is that our death rate in Garland County is significantly higher than the death rate in the state as a whole. We as of last week, we had what was basically 155 deaths per 100,000 people, whereas statewide the range is more in the 120 to 125 deaths per 100,000 people, which reflects, I think, a lot of the fact that we do have an older community, a greater percentage of elderly people, and that's that are by far the ones that are actually dying from this disease. There are some positives on the horizon, and I want to kind of mention a couple of those. I'll talk about the vaccines later, but one of the things that we did talk about, and that there's been a little bit more emphasis on, is the use of the monoclonal antibody infusion, and that has been developed over the last several months. And I think that it's been studied somewhat, but it's a new therapy. But we had some anecdotal reports from our hospitals that they're seeing some really good dramatic improvement in patients with this, and basically what it is, they have been able to manufacture the actual antibody against the virus. It's something that has been developed early on in the pandemic. They were using some convalescent serum from people that had recovered from the infection, and using that in people that had been recently infected with the COVID, and they were showing some positive responses. But now we have the manufactured monoclonal antibody, and there are some set criteria on who qualifies for this. Generally, it's people that are over 65. Some over 55 if they have significant other healthcare problems, and it has to be with people that are somewhat symptomatic. It's not for asymptomatic people, and it's not for people that are seriously infected to the point that they need to be on either in the hospital and or on supplemental oxygen. So it's that group of people. And again, what the reports from our hospitals is that the people that have gotten this infusion, it's done as an outpatient, and that it's done remarkably things as to helping people feel better and get better, and probably one of the big things, it's been able to prevent people that would potentially have needed to be in the hospital and on supplemental oxygen to not have to do that. So the way it's set up now is, like I say, it's an outpatient, and it's a designated area in the two hospitals where they do this infusion, and it has to be ordered by a physician. So if you meet that criteria, something that you need to discuss with your physician, and if he or she deems that it's appropriate, they will make arrangements for you to get this treatment as an outpatient at the hospital. And of course, I think one of the things that we're excited about and in the early stages of is the vaccination program. As we discussed before, that there are two vaccines that have both gotten emergency approval from the FDA and are starting to be in wider use around the country, and certainly around Arkansas. The vaccines have shown to be highly effective and very safe, with very few serious side effects. I think Dr. Romero mentioned in their news conference this week that they had of the I'm not sure what 60,000 vaccinations in Arkansas. They had only had 22 cases where there were some kind of reaction, but all of those were considered minor and not of significance. So that is something that we're really trying to promote. The fact that these vaccines are effective and safe, and we hope that when more vaccine is available to more people, that they will take advantage of that. The state has come up with a plan on the distribution of the vaccines, and also the groups that are prioritized as needing the infection or needing the vaccination and qualifying for it. And we might show this. This is a kind of a chart that explains it from the health department. I'll go through a little bit of it. We're currently in phase 1A, and we've been in this for probably about 3 weeks now, when we first got the vaccine into the state. And this really covers the healthcare workers, and we're still got a ways to go before we're gonna be able to complete this group, but we are making progress. The initial vaccine that came out were sent to the larger hospitals, and I think that they've done a very good job in vaccinating the people, especially the people that are on the front lines and dealing with the COVID patients on a daily basis. But we're trying to, in the process of expanding this to other healthcare workers that are not hospital based, and we'll probably be in this phase for at least till the end of January, and because there as far as qualifying entities, it goes from just individual clinics, doctors' offices, also dental offices, blood banks, people that work, that are going to be in close proximity, or potentially in close proximity to people that might be susceptible to having the vaccine. Also, a really big part of this 1A group is the long-term care facilities, and we were able to start just last week having the vaccine available to both the residents and the staff in the long-term facilities. It's a little bit more difficult to arrange this. The way it's set up is that the designated pharmacies, which is CVS and Walgreens, are actually taking these vaccines to the nursing homes, and the nursing homes are administering. Generally, they're the ones that are administering the vaccines, and so there's smaller numbers as opposed to the hospitals, and but also it is considered a very high priority because of the severity of the disease and the number of people that are very sick and are dying with it. So that's a big step. like I say, we're still in this, and there's still a lot of uncertainties as to how this is going to play out and how long it's going to take. In Garland County, there's one pharmacy that has been designated as the main pharmacy for the vaccine that's going to come into these other places, and we'll have the link later on of this particular pharmacy, and they're in the process of setting up probably some vaccination sites, probably for next week, for people that work in the health as a healthcare provider in a setting where their employer or the clinic is too small to really to have their own vaccination programs, but don't have any specifics. But my understanding that those things are being developed and hopefully will be announced within the next few days, because there is definitely planning on starting to implement this. Again, hopefully we will be able to complete this phase in the month of January. And there's approximately, I think, statewide, maybe 80 to 100,000 people that will qualify for this. And right now, we are the number of vaccines. I think that the state has gotten us in the range of 120, 130,000 doses. And there's in some of the reporting as to how many of the vaccinations have actually been given. There's a lag time because of the reporting requirement. Is they don't have to. Here's some specifics on that. The entity that's actually administering the vaccines have 3 days afterwards to get the report in, and I think I've heard some questions about why it takes 3 days, and from what I'm seeing is that the places that have the vaccine and have the people that need the vaccine, they're really putting all their efforts to get the vaccine administered, and then doing the paperwork to get it registered. So I think they're like this 34% of the vaccines that have come into the state that have been given is probably low because of that lag in reporting. Also, with the long-term care facilities, I think that they're ramping up, and I suspect that again over the next week or so we're going to see a much higher percentage and number of vaccinations in that group. And the goal, and again it's a variable thing, is that we'll be able to enter phase 1B in starting the 1st of February. And this is a much a larger group of people. It involves everything from teachers, school staff, people. There are also people that are 70 years and older will qualify regardless of their health status for the 1B vaccine. And then one of the things that's not correct in this slide is that originally, or the CDC came out originally having first responders, the fire and police, to be in 1A. They switched it to 1B, and the governor announced last week that in Arkansas we were putting the first responders back into 1A where they were originally, and so I know that here in Hot Springs that the police department and the fire department employees are already receiving, and many have already received their first shot, which is, I think is good, and it's important because of what a vital role that they play in our community. This 1B it's a much larger group of people than 1A. I think it's almost 400, I think around 450,000 people in the state of Arkansas that will fall into this group. So it's estimated that that's going to, assuming that we get a good constant supply of vaccine into the county, that it will take 2 months to really get that group vaccinated. And again, the hopeful timeline will be to start in phase 1C in April, and this is basically everybody else. They may put some priorities within this group, probably mostly people that are over 65, and then people with some high-risk medical conditions. But it's a much larger group. I know that I'm getting questions, and I know that pharmacies are getting questions on how to basically get in line to get your vaccination, and it's not really worked out real well. There's a lot of logistics. They're looking at options of having vaccination clinics in a centralized location. But there's really so many variables because we really don't know how many doses of vaccine that we're going to be getting at any given time, and so we don't want to set up a specific vaccination clinic and have a lot of people go to it or sign up for it, and we not have the vaccine to administer. I think that in some states that's what they've done, and it's I know I've seen pictures and reports from Florida where you'd have thousands of people showing up at a site where it had been advertised that they were having a vaccination program, and people were waiting in line and would quickly run out of the vaccine. So we want to do the best we can to minimize those types of situations, and have more of an orderly administration of it. But again, we want to be as expeditious as we can to get that done. I know that one thing that it's a village pharmacy, and I think we'll have the link to that, which is the designated pharmacy. It'll be the conduit for the vaccine coming into Garland County for this, especially for this phase 1 and phase 1B, and they'll be doing several things. They'll be kind of instrumental in providing the vaccine when we have these vaccine clinics, and then also be distributing to vaccine to other pharmacies, and also there are clinics and doctors' offices that have signed up and will hopefully eventually be able to do the vaccinations. Of course, one of the things that we talked about all along is that the sensitivity of this vaccine, especially the Pfizer vaccine, the requirements for storing at a very low temperature, and also when you do thaw it out, and especially when you dilute it, after you diluted one vial, which has about 6 or 7 doses in it, if you don't actually administer those doses within about 30 minutes, the vaccine becomes inactive and unuseful. So that's one of the kind of complicating factors that are kind of being worked out, because we want to vaccinate as many people as we can, but we don't want to be wasting vaccines. Also, one of the things that in phase 1 that we're already starting to move into is both the vaccines require a second dose to be fully effective, And again, especially in the hospitals, I think that they are actually administering the second vaccinations to a lot of especially the frontline workers. So I think those are the main issues that I wanted to at least throw out and cover, and I think we probably have some questions that we're going to further the discussion with.
Thank you, Dr. Shelby. It was very thorough on the vaccination rollout process, so appreciate that. And if anyone's watching live or after the fact, this video will be posted in our Facebook video section on the videos tab of the library's Facebook, so you can go back and refer to this if you missed something or you would like to show someone else, or just make sure you heard something right. So I'll break the ice on the questions here, Dr. Shelby. There's been a growing demand to enact stricter measures to fight the spread of the virus. So my first question to you is, when it comes to creating and enforcing guidelines and restrictions, could you clarify what power you or the Department of Health has in a situation like that versus what power or authority various government officials might have?
Well, I don't know that we have really any specific power locally. I mean, we, as far as promulgating any kind of restrictions, they certainly there. I mean, there are the mask mandate in effect. There are the limits on things like restaurants and bars and other congregate settings, and we do have. Especially with our local law enforcement and the Alcoholic Beverage Commission agents, to enforce those things, and I feel that they're doing that on an ongoing basis. I think a lot of the enforcement is education. I don't know that just for not following the standards that many places have been shut down or had their license pulled. I do know that. When they have a positive case, say at a restaurant, the health department does require them to close until and do a thorough cleaning, and then of course in a small business, if one person tested positive, usually there's enough close contact that the other employees would have to be in quarantine, so they wouldn't really be able to stay open and follow the regulations as far as isolation and quarantining. I think the governor has addressed as to whether any further shutdowns would be coming down from the director of the health department and the governor, and I don't know of any that they're planning on. I think one of the things, and I agree with it from what I know, is that that a lot of the spread is coming from small gatherings and of one sort or another, and not from places like the restaurants. They do have a curfew on bars, and I think that's a good idea. That, as they say, nothing good happens after 11 o'clock anyway, and especially if alcohol's involved. So I think that's that as far as the regulations. I know personally I'm concerned with things like churches. I know that I've driven past some small churches that I've never been on the inside, but on Sunday morning, and the parking lots are full, and so I think it's assuming that there was more than one person in each car, and I think generally at a church service there are, that it'd be hard to maintain the proper social distancing. But since it's a religious institution, there's no specific requirements for that, and we're just really kind of trusting people to do the smart things. And also, I think anything, weddings and funerals and then just the normal family and groupings that occur around holidays. And I think we're seeing what the outcome of those types of gatherings are. That's when we're seeing the increased cases and I don't know that the government can really regulate that. You can certainly encourage people to not have large gatherings, and if they do, to try to have them outside and have good air circulation. But people are going to do what they're going to do, and we just have to try to educate them and point out the risks of this. It's been around here for 10 months now. And people talk about pandemic fatigue, but the virus is not getting tired. I mean, we're seeing the increase in the cases and the severity and the deaths, and this is a highly contagious, highly deadly virus, and there are some simple things that can help to prevent the spread, but people have to take it seriously.
So while acknowledging that the health department doesn't have any direct power to make this call, maybe you could give some insight into the logic behind this decision. And if anyone from Oaklawn is listening, don't shoot the messenger. Someone sent me an email, and her question was, how does it make sense that bars have to close at 11, but not bigger venues such as the casino?
Well, I'm not sure exactly what the regulations are. I know that when the casino opened up, they were very, very meticulous, and I think one difference about the casino than just a bar is that the casinos have a long history of watching everybody that's in there and taking appropriate action if someone is not following the rules, whether it's drinking too much or being boisterous and inappropriate, and so they're used to telling people what to do and telling people to leave if they're not following the rules precisely. Whereas I don't have the confidence that a small bar is going to be as diligent as that and have people whose job is to watch what other people are doing.
So you covered hospitalizations earlier. There's been social media posts from local healthcare workers and patients alike who have mentioned our local hospitals are feeling stretched pretty thin. Is there anything being done to ease pressure and workload on individual healthcare workers?
Well, I think the vaccine is a big step forward in terms of protecting them, because at certain times during the pandemic in Garland County, especially when we had the large number of cases in the nursing homes, we had a large number of healthcare workers that were infected. And I think we even had some deaths from healthcare workers. So, I think it's totally appropriate that they should be the first ones to get vaccinated and try to really do all we can to prevent illness within that group. So I think that they're working hard and they're getting tired and frustrated. But we're fortunate to have the dedicated individuals that are on the front lines here in Garland County.
Our population density is of course a lot lower than California, but we've seen the lines of cars in LA just waiting to get to the ER. What are our contingency plans here if our hospitalizations did reach capacity?
Well, I think that I'm not. I don't know what the precise plans are. I know that there are areas in both the hospitals that they can expand into patient use areas. But one of the big limiting factors is staffing, and I know that some of the contingency plans in terms of staffing will bring people that normally work in clinics into the hospital setting, people that normally work in non-patient care, are doing patient care. So I think that those are the types of things that they're looking at to in order to meet the needs.
We got a question from Debbie who asks, where are the high numbers of cases in Garland County coming from?
I think it's pretty well widespread. The only large area that I'm seeing in the numbers that I'm aware of have been in the Hot Springs Village area. But I mean, there are a lot of people there, and so I'm not on a per capita. I'm not sure that how much bigger that they are. They had done such a good job early on in preventing cases there. But as far as anything else, I really think that it's really widespread in the community.
Let's move on to the new COVID variant that was discovered in the UK. It's now confirmed to have cases all over the world, including, when I checked earlier, it was 8 U.S. states. What do we know about this new variant, and how concerned should we be?
Well, I think one of the good things, from at least from what I've read and early studies on it, is that the degree of illness that it causes is no more than the normal strain, and that and then also that the treatments that are used for the normal strain are as effective, and that the vaccine is as effective against it as it is the normal strain that we have. And so if everybody was doing what they're supposed to do in terms of the masking and social distancing, that will prevent the spread even of this variant. But at the same time, people that aren't following the proper procedures, it's more likely that they will spread it to more people. So I think it's more from an epidemiological point of view, because I think that they study how many people are infected by one person, and I think with the normal strain of the COVID, one person will infect 3 or 4 people. Or you compare it to the flu, where one person will, on average, will spread it to one other person. And so this is I don't know the exact numbers, but the average may be 6 people. So it's but again, it's something that just if people do what they're supposed to do, it's not going to have that big impact. But for people not taking the proper precautions, they'll spread it to more people.
Does the extremely widespread global nature of COVID make it likely there's going to be other variants that evolve?
Well, viruses kind of mutate and change routinely, and this one is no different. It's just that most of the changes have not been really significant mutations that really affect the severity of the illness that it causes, nor it affects the treatments and the vaccination is equally effective to it, because and then this is one of the amazing things about the vaccine, and how it's all on kind of DNA RNA based, and so that it targets some fragments of the structure of the virus itself, and so you can have a lot of internal kind of mutations, and it's really not going to affect the effectiveness of the treatment.
We know that there's some period of immunity after you get COVID. If you get the mainstream form of COVID, do we know if that immunity will apply to other mutations or variants?
I think so, but because they have looked at the effectiveness of the vaccine against the different strains of the virus, and it seems to be equally effective. So I would kind of assume from that if if the vaccine is effective, that the treatments will be effective too. Like I was mentioning before, the monoclonal antibody infusion seems to be helping, a significant number of people, and I think that's going to help. It'll help people that might have this variant too.
What's the latest science on how long that immunity period generally lasts for people?
Well, I think as far as people that have recovered from the infection, it's really not known. I think probably people's best guess is maybe 2 or 3 months, but it's one of the amazing things that this is a new virus, and we still we know so much about it within the first year. So it's not surprising that we don't have any real kind of specific knowledge about things like that. I know that one of the recommendations that I just became aware of is that people that have had a COVID infection, there's no restrictions on taking the vaccine. And it's encouraged for people to go ahead and take the vaccine because I think it's probably known or certainly predicted that the vaccine is going to give a much longer protection than just what your body produces as far as antibodies. I think the one thing that I forgot to mention about people that get the monoclonal antibody treatment is that the recommendation is not to get the vaccine for 3 months after they've had it, because they're not really sure whether having the monoclonal antibody treatment might inhibit the ability of the vaccine to be useful.
And we talked earlier about how, of course, people have to get a second follow-up dose for the vaccine to be truly vaccinated.
Right.
Is there any impact from that first dosage that will help prevent their spread of COVID?
Oh yeah. I mean, I think the studies that I've read about that a single dose would give you about 50 to 60% protection, which is great. I mean, that's I think that's a tribute to the effectiveness of the vaccine. But by getting the second dose, you get your protection up into the 90 to 95%. And so the recommendation now is still for people to get the second dose, and that's part of and maybe part of one of the reasons why things are a little bit slow in getting people vaccinated, because you want to make sure that you have contact information so that people do get that second dose of the vaccine. The time separation, it's 3 weeks for one of the vaccines and it's 4 weeks for the other, and those are minimal intervals, so that if someone gets the vaccine, they're supposed to get their second dose in 3 weeks. If they wait 4 or 5 weeks, there's no downside to that, except for that you won't get the maximum protection until you've got that second dose. And another thing that I think is pretty well established is that you have a more likely chance of having a local reaction from the second dose, in terms of soreness at the injection site, as well as the kind of aches and pains and just not feeling good. I think one way to look at that is that it shows that the first vaccine is working, and that the fact that you're getting a response from it. So I think the vaccine is meeting the expectations that we hoped it would.
And to confirm, no matter where someone goes to get their first dose of vaccine, they're going to have a follow-up appointment scheduled right then for the second one?
Correct. And also, one of the things that was established early on is that the vaccines both of them are very highly effective, but they're not interchangeable. So that if you get the Pfizer for your first dose, you have to get the Pfizer for the second dose, and the same thing for the Moderna.
Thank you. So another question about the immunity period. Is it possible for someone to carry the virus and still infect someone during that time?
No, one of the things about the virus, it's of course you have to kind of divide people into symptomatic or asymptomatic people. But the people that are asymptomatic and get the virus, it's more of a time frame thing, and that's why people are considered to be have recovered from the virus after 10 days after the sample was taken, if they're asymptomatic. Now, they may still can test positive, and I've heard that people that have the virus can test even without symptoms, can still test positive up to 3 or 4 months after their infection. And I know this has come up in some discussions that I had this week. Some employers are requiring or having a negative test before people come back to work, and then there's just really no justification for that. That people will still shed some virus, but it's not to the degree that they can infect somebody after the 10 days. So having a negative test is not necessary, and in some ways it's detrimental to someone that's happy, healthy and ready to go back to work, and there's no scientific reason why they can't. But waiting for this negative test that may be a long time coming, and is not really significant.
Unless they're symptomatic.
If they're symptomatic, it's a different ballpark.
Right. What is the latest we know about the vaccine side effects and safety? I know there was some controversy over the vaccine on people that had allergies.
Yeah, it seems to be pretty specific that the people that have had the anaphylaxis, and which is a severe a reaction, they have it almost immediately after they get the vaccine, and it's really not I'd say it's mainly considered that we worry about that in people that have had severe reactions, and even not just reactions of redness and soreness, or even kind of a more widespread redness, but if people that have had an anaphylactic reaction to a vaccine, those are people that are at risk and would need to have their vaccine. They could, if they chose to have the vaccine, they would need to have it in a controlled environment. Anaphylaxis is something that we treat. I've practiced emergency medicine for 30 years, and you would treat people that had anaphylactic reactions to a lot of different things, and it's treatable. I mean, it's pretty scary for everybody involved, and certainly the patient, the family, but also the medical personnel. But at the same time, if you have the proper equipment, proper medicines, that it can be managed. But with the COVID vaccine, it's such a very rare occurrence, and we'll see, because even though it's been approved, it's still being studied on a long-term basis, and with more and more people getting the vaccine, we always learn a little bit more about it as it's in wider circulation. I'm sure that'll happen with this vaccine. But there've been, worldwide, there've been a lot of doses already administered, and they're being watched real closely. And to my knowledge, the recommendations in terms of the vaccine and the potential downside has not really changed.
I received a couple of questions from Shannon via email, who is a parent of a 16-year-old junior who is currently doing this year of school virtually. And our first question was, is it likely that she will have access to both doses of the vaccine in time for her senior year in the fall?
Uh, I really can't speak. I really can't say for sure about that in terms of the timing, and I'm kind of blanking on the age limit. The vaccine has not really been tested in children yet, but I'm not. I think it's age 12 that. And there probably are some ongoing studies to test the vaccine in children, but I'm not aware of it. But as far as the availability for someone, I really think that as a general rule that we'll be able to have people have both of their doses of vaccine, certainly by the summertime.
And just to clarify, her daughter was a teenager. Did that make a difference?
Again, I'm sorry, I don't have access to information right now to see what the age cutoff is. I think it's 12, but I couldn't say for certain.
Gotcha. She had a follow-up question about her other children. She asked, when her older daughter does receive it, what are the chances she could still bring the virus home to her younger siblings who won't be able to get the vaccine until a pediatric version is available?
Well, like I say, it's I mean, you certainly can't get an infection from the vaccine itself, from just the way it's made. But the chances, if someone has had 2 doses of the vaccine, the chances of them becoming infected with the virus are really, less than 5%, even if they've had a strong exposure to it. So I don't think that would be a real big concern.
Got a question from Miss Lewis, who asked, my husband's primary doctor said that if he has COVID symptoms, he can come to the doctor's office and be treated with antibodies. Is this correct?
No, the monoclonal antibodies is always it's an IV infusion, and I'm not aware, and I don't think that there are any outpatient clinics that are doing that. Now, I think there have been some other kind of antibodies that kind of oral antibodies and that have been promoted, but the main and the approved antibody infusion it's an IV, and it's done in a hospital setting or outpatient hospital setting. One of the exclusion criteria is that the person getting it is not sick enough to need to be an inpatient in the hospital.
The UK reported that patients in intensive care are to receive arthritis drugs as trial shows reduction in mortality. Have you heard anything about this treatment?
No.
All right, and one final question before I let you wrap up. How's our flu season doing?
Well, from all that I'm hearing, we've had a very, very mild flu season, and I didn't really put a whole lot of stock in December because a lot of times the flu doesn't really hit here until January. But from all that I'm hearing, it's not very much flu around, and I think that's almost really what would be expected. I hadn't seen any numbers, but with everybody talking about how important vaccines are this year, that and encouraged to get the flu vaccine, and there's a lot there. If you want to get a flu vaccination, you don't have to go through the hoops, or you don't have to get the coronavirus vaccine. You can go get a flu shot tonight if you hadn't done so, and I would encourage you to do that. But also, I think the masking and social distancing and hand washing has definitely has the potential to reduce the incidence of flu this year. So I think there's some different factors there, but right now everything looks like we're going to have a mild flu season.
All right, so our next update is going to be Thursday, February 4th, same time at 6 p.m. So if you think of any questions, anyone watching between now and then, feel free to get them to me near the library, and I'll be sure to ask them live. So Dr. Shelby, I'm going to let you wrap us up. Any final words?
Well, I think one of the main things, we're on an upswing in this pandemic in Garland County, and the vaccine is here, but it's not we're not going to see significant changes because of the vaccine for 2 or 3 months. So even with that, you've got to do all the things that we've been talking about all along. Masks, hand washing, and social distancing.
All right, thank you. I appreciate your time and appreciate everyone for watching. Have a good night.
Good night. Good night.